Nowadays, implantology is something pretty commonplace in any general dental practice. In the past, it used to be a specialty only. That's how I got into implantology. I want to learn from the best. Based on the small practice I have and the kind of patient needs I have, I think this course is very instrumental for me to deliver for my patients and their needs. The change I noticed, the way I started seeing my patients, especially when it comes to implant cases, I'm spending more time, 2 or 3 times more amount of time in just case presentation with my patients, understanding their needs, understanding their expectations. So in other words, my case selection time and diagnosis time has only doubled and tripled. In the past, probably I'm trying to rush. These implant cases or implant expectations are not just something done and done for all. It's a long journey because we're aiming at long-term stability, long-term solutions. So there is no looking back. So from the get-go, you should plan for the future. This course has met my expectations and beyond. I think if you are planning or doing implants, I would definitely recommend you to come